morning, and thank you very much for joining us. Hope you had a great weekend, but it must have been a cautious one as well. Everybody's cautious. Well, there are efforts to fight the spread of COVID-19, as you well know, all over the country. All governments are up and doing. And this morning we'll be zeroing in on the efforts that are ongoing in Lagos State. And to that extent, we have the spokesman of the governor of Lagos State, Mr. Boyega Akoshile. Good morning. Well, may I call you Boyega? Because normally it might be Honorable Mr. Akoshile.
No, I'm just Boyega.
Great to have you. In fact, this is the first time, since taking office.
Yes.
It's been a hectic time, I would imagine. So let me just start. This is one of those things where the entire public is reading everything, listening to everything, and there's a sense in which sometimes there might be information overload. But maybe I could start from how involved and let me rephrase that question. All the governors are fully involved, but how satisfied is Mr. Governor of Lagos State with the operations so far?
Okay, thank you very much, Uncle Yori.
Yori, please.
Yeah, but I know that if I were a co-presenter, I know that we're on first name basis on television, but here I'm a guest.
All right, then.
Yes.
All right,
okay.
then.
Thank you very much, sir. As you may have known, as you may have noticed, we have a very proactive governor in Lagos State. He's one man who does not leave anything to chances. He doesn't want to gamble with anything, particularly security of lives and property of the people of Lagos State. He cares so much about safety of the people. Now, when the issue of it wasn't even COVID-19 then, when the issue of coronavirus was brought to the fore last year. He was briefed by the Honorable Commissioner of Health, Professor Akin Abayomi, and they held several meetings. People didn't really know about it then. They held several meetings over this coronavirus that was coming then, and immediately Mr. Governor triggered some activities. He set up what we call incident command, and he launched it. He personally made himself the chief incident commander, meaning every activity must stop at his table. So what does that tell us? He does not want any excuse. He doesn't want to delegate anything that is very serious, that is as serious as this kind of issue. So he wants to personally handle them by himself.
Okay.
And that's why
so like leading from the front.
Exactly. He wants to be at the forefront of the battle.
Even though there are trusted professionals and experts all around.
So the expert, the Honorable Commissioner of Health, who is, by the way, is a professor of biosecurity, is made the deputy incident commander.
Okay.
So you have an administrative head, a political head who has a political will to so direct as the head of the command center, and then you have a core professional, supporting him. Mm-hmm. So we have a very powerful team in Lagos State. You now have several other team members,
okay,
comprising doctors, health professionals, health workers, media, communication experts, including the Honorable Commissioner of Information and Strategy. So all of them, were put together by Mr. Governor in his wisdom to sensitize Lagosians about the looming or the imminent danger ahead. Because, like the Yorubas would say, umbo awalandedi, and this still is very much relevant in this day and time. So that's why Mr. Governor set up this, okay? And going from that on a regular basis, Mr. Governor kept giving. Then, that was even before we recorded the first case in Lagos.
Indeed. So sorry to interrupt you, because as a matter of fact, I'm just hearing breaking news that Nigeria has recorded its first death of coronavirus here in Lagos. Details are sketchy, but that is what is just being said into my ear as we speak now.
Okay, I actually got, as I was stepping into the studio, you saw that I was on the phone.
That's right.
That was the information I got, and if you heard me, I said to the person,
that it must
please
be confirmed and
confirm.
reconfirmed.
You know, that was what I said to the person. I said, please.
Our news chaps have confirmed it. Is why they are now saying it into my ear.
So that was what I was saying to the person, that please confirm before.
Well, actually, there's been a correction that actually it is circulating, and that they were hoping that you might be able to confirm or disprove.
Oh, okay. No, I can't confirm that. And you know, anything that has to do with death, you really have to be very careful before you, even as a journalist, you have to be very careful before you break such
So actually,
news.
Scratch that.
So that was what I was
saying.
Saying.
Told that actually it is circulating, but hasn't
no,
actually
we
gotten
don't.
official confirmation.
In fact, it was part of what Mr. Governor keeps saying.
I said about
it's part of what Mr. Governor keeps saying, that people should be very careful about news going around. So we're living in the day. I mean, a digital age now, and everybody is a journalist, so to say, with a phone. Somebody will sit in his room, you know, type something, and it will go viral. So people must, you know, listen to what NCDC says, National, Council for the Disease Control, as well as Federal Ministry of Health and Lagos State Ministry of Health. Our Twitter handles are everywhere, and also the Twitter handle of Mr. Governor and some of us who work directly with him. So if you do not confirm from those places, I don't think, you know, you should.
So we'll just have to, you know, as it were, you know, keep our hats on and wait for official word to come on, which hasn't come on in relation to, you know, what I...
So going back to what I was saying.
Yeah, but sorry to interrupt you. You know, I started by saying I wonder how satisfied Mr. Governor is. I was around town yesterday by way of driving around, and I saw that there were all sorts of health corps people, police people, uniformed security people. You know, all of those people, including a big van, usually the type that is used for
Black Maria.
Well, only green. It's green Maria this time. It must be
green that you saw.
If you get my, well, it was green.
Yeah.
And that goes back to, maybe we can talk about this a bit. Perhaps the recalcitrance of some people in Lagos State, as everybody is speaking about, you don't need to be where it is not essential for you to be, especially if they're more than, is the number 20 or 30? You don't need to be in those places.
Exactly.
People still insisted, I understand, in having their little get-togethers over the weekend. Now, is it the policy in Lagos, do you know, that there's now zero tolerance for that kind of a thing?
Okay, it is zero tolerance for
gatherings.
For gathering of more than 50 for now. For more than 50. And
is the Lagos State government willing to enforce this? Because
we have actually started enforcing.
Okay, meaning that does enforcing mean that you would burst a party if you find a party that is going on?
Exactly,
the government will actually burst that party.
Exactly, and and that has been happening. And in fact, we monitored on your platform here on TV Continental how the task force that was set up by Mr. Governor, comprising LASEPA, that's Lagos State Environmental Protection Agency, headed by Dr. Dolapo Fashawe, as well as Lagos State Safety Commission, headed by Mr. Larry Mojola, and the Commissioner of Police, has his own team there. Mr. Odumosu has his own team joining, and then we have other other forces joining them to enforce this directive by Mr. Governor. Because, the idea is that if the governor is doing so much, if the governor is having sleepless nights because of your lives, you also should do your own part by obeying simple instruction. It is not going to hurt if you do not attend a party today or tomorrow. It's just for the meantime. Just stay away.
So parties, can it be taken officially that for now, parties are not allowed if it involves getting together about 50 people?
Exactly. Not allowed.
In the case of the churches, I understand the number came down from 50 to even less than 50. Can you give me any facts there?
Okay, the fact of the matter is that it is still 50.
Okay.
Now, it may be reviewed, but we are getting compliance. The level of compliance, to go back to your question, is a bit satisfactory. But the way we are as a people, we just need to continue to talk to the people. We need to inform them of the dangers in gathering, because this is a virus that gets easily transmitted via bodily contacts.
Are we hampered by democracy and its inherent rights? Otherwise, I would have thought that this is a matter of claiming your fundamental human rights in that particular kind of way could have fatal consequences. Whereupon, I don't know, people have said one of the reasons why the success that China is reporting now happened is that perhaps democracy is not, is not very, very developed over there. And so when they say, please don't do this, then you don't do it. But other places, well, specifically here, let me just talk about here, and then in Lagos State. For instance, as I said, I was doing my own quasi-monitoring, driving around town. And one place I went to was the Ikeja City Mall in Lagos yesterday. Now, I saw the situation there, and I must say that it seems that the management there have, they're taking their own efforts as well. They're making their own efforts. For instance, there was a queue to enter into ShopRite itself. They were reading temperatures, they were sanitizing before you went in. You couldn't, they were allowing only 20 people in at a time, and wouldn't let another batch of 20 go in until 20 came out. Now, that is fine, but I noticed that the problem they had is that there was a queue to get into the place. Now, whereas once you're in there, for instance, the queue of wanting to pay, the checkout queue, they did maintain the 6 feet distance by, conveniently putting strips of tape next customer, so you can't be less than 6 feet, away from the guy who's paying in front of you. But the queues were not 6 feet. And I remember I called the chief security officer that I spoke with, and I said, there's something wrong here. And the guy, he scratched his head, so to speak, that what are we going to do? If you maintain 6 feet long in a queue, so the whole idea of a queue, I don't know, could you speak to those kind of contradictions, those kinds of difficulties, because people want to go. Maybe thanks be to God, in Lagos, people don't think it is an emergency yet. Maybe. Because if you must want to go into ShopRite and you are prepared to queue in spite of all the news, and the queue is something like you are 24 inches away from the next guy, you see all the contradictions and that democracy is allowing.
Okay, so I'll start by saying that no right is absolute. Your right stops where my right starts from. If, because of your rights, you want to have freedom of movement, and that your movement of freedom of gathering, and those gatherings of yours, because you have rights, will create public safety, I think government also has a right to stop the gathering. So we need to understand that. And well, maybe that would be another subject for the law courts to begin to analyze and unravel. But be that as it may, government has done so well with the pronouncements made by Mr. Governor, Mr. Babajide Sanwo-Olu, so far, that people should practice social distancing.
Yeah.
And ensure that.
And clearly everybody isn't listening, why there has to be a monitoring team to go around to enforce it.
Now, speaking about other places like you just mentioned now, it would be very difficult to shut down. That would be tantamount to shutting down the entire state. It would be very difficult to shut down Lagos State completely.
And I'm sure Mr. Governor is keen not to spread panic.
No.
Yes,
no.
so that
No, apart from spreading panic, I think it's a question of so many variables that you have to look at here. Do we have the kind of economy as a country that can sustain a total shutdown? You have to think about the lowest of the low, whose sources of livelihood depend on daily earnings.
That's
For
especially
example,
in the
especially
open markets,
the
our
open
traditional
the
markets.
traditional market and all that. How many people belong to the workforce that earn salaries? The informal sector is perhaps
So there are going to
higher
have to be some
than-
compromises, so to
exactly.
speak,
So
for
you have
now.
to be, so that's why we're doing a whole lot in terms of communication, in terms of sensitization. And I must say the ministries of health, as well as Ministry of Information and Strategy in Lagos State, have been doing yeoman's job.
Even the Ministry of Transportation.
Even the Ministry of Transportation.
I see an advisory regarding...
Exactly,
Because
the Ministry of Transportation...
what is Lagos without its transport system? And the transport system for now is Danfo, while people are working on the light rail and all of that, is Danfo. Now, you can't possibly maintain a 6 feet distance in a Danfo bus. And people are getting stresses who try, even though the Minister of Transportation says that it is advising, 60% capacity of buses as opposed to 100%. In the BRT buses, I've seen the notice that no more standing
Okay, so
passengers.
let me explain to you the way this will be achieved, very logically, sir. The workforce of Lagos State has been reduced by 70%.
Workforce reduced by 70%.
About 70%.
You're talking about the ministries.
The ministries, the workforce, the unified, civil service
okay.
of Lagos State. With the pronouncement made by Mr. Governor yesterday,
has been reduced.
Yes.
What does that mean? You told them to stay away?
No. Reduced from the roads. You understand? Because they're going to be staying at home to work from home from today. So if you go to Alausa now, you're likely not to see a whole lot of people. And that's hundreds of, thousands of people to stay at home and work from home.
Okay.
In fact, there was
Lagos is able to operate that scheme.
Yes, that's what Mr. Governor directed yesterday at the briefing. Home. Yes, at the briefing that we had yesterday. So now, when you remove that huge number off the roads, it reduces a lot of pressure, from the road and public transportation sector. So now, the Ministry of Transportation on its own is also working with the National Union of Road Transport Workers as well as other associations, there, to sensitize them, to ensure that they wear gloves, they wear nose mask and all that, and get they check temperature, and they're doing a whole lot. So government has also ensured that this thing goes down to the local government, not just the local government, headquarters. We're talking about the Bales, the KBACs, and so we are the government of Mr. Sanwo-Olu is doing a lot, not just at the upper level, the upper middle class, the middle class, the lower and the lowest of the low. So it is a bottom up kind of sensitization that the governor has been doing since this COVID-19 started, and we've been achieving a whole lot of success. For example, the Italian man that was first recorded in Lagos,
okay,
has been discharged.
I'm getting. That's good. That's good. That's good to hear. Has been discharged, but I'm also getting confirmation that the first case that has been recorded that we were saying we didn't have, confirmation for at that time a few minutes ago, apparently has now been confirmed and is. We can't see it in studio, but it is scrolling right now on our station. So maybe this will.
Is it in Lagos?
Actually, it's not in Lagos. In Abuja.
In Abuja.
In Abuja is what I hear.
Okay.
So again, this is just breaking, so we'll probably get more news on that as we go along.
So that would be the first death in Nigeria.
The first death in Nigeria, which is it's a pity, but
It's very sad.
It
It's
also
very unfortunate.
It is. It also brings it home that this is serious. This
It's
is
very real. I woke up in the middle of the night, and around 3 a.m., went straight to my Twitter, and I saw that, the former Vice President Atiku Abubakar tweeted that his son has been diagnosed and tested positive for coronavirus. So
now
it's actually home. It's actually in the
yes,
community.
As unfortunate as that is, and we certainly wish the former vice president, his son, well, and we hope he gets, well soon. This honesty, this forthrightness, this coming forward, is also part of the ammunition of fighting this whole thing. Not to stigmatize it, because that's one of the things that we heard from a doctor who was with us, in one of your doctors, as a matter of fact, the senior special assistant to the governor on health. She was here.
Okay, Dr. Fini.
That's right.
Yeah.
She was here on Friday. This, and it's a difficult thing, perhaps, if you don't understand it thoroughly. Politicians have been accused of not always putting the whole truth out there, but we're seeing that we're breaking that particular barrier. And as I said, once again, we do wish the son, from what you said you read on Twitter, wish the son of the former vice president well. So as we're going along now, you said the governor is satisfied with things that are going on. And,
with the operations of our compliance team, the task force team set up by the governor. Compliance level has actually is about 60 to 70%.
I suppose people are going to have to keep on listening to the advisories and then apply common sense. Because I hear what you said, but people in Lagos still will need public transport. And there aren't enough BRT buses yet. And so downfall will have to be patronized. And we already noticed something of a challenge, even though I was saying that I was reading a release from the Minister of Transportation, which you've also spoken about, that, look, 60% capacity is what they want those people to do now. So I suppose all of these things, and the way government is going about this, you were saying that, look, people have to be reasonable. They have to understand where their right stops is where the other guy's right takes off. And how strict, let me put it that way, is Governor Sanwo-Olu, going to allow operatives to be here?
Very, very strict. Mr. Governor actually gave them, matching orders, and he actually also read it on a live broadcast yesterday, that government, and if I want to quote him, he said government is going to frown. That's the word he used.
Yes.
He said government is going to frown
severely
at anybody, be it religious organizations, social clubs, or event center, that disobey the government's directive of not more than 50 people.
Okay, let me take Jide, who has called in from Ojota. Good morning, Jide. Hello, Jide in Ojota, good morning.
Good morning.
Okay, we can hear you. Please go ahead.
I'm fine. I just want to make a confirmation.
Yes.
How do you really differentiate between the malaria symptoms and the coronavirus symptoms?
Okay. I wish you had been with...
need to explain to our people, because people need to be able to differentiate, because naturally we have malaria in our country.
Okay.
We are used to that. So, but the symptoms look similar to each other.
Indeed.
So we need them to explain to people, because some people might just be out home thinking they have malaria.
Yeah.
They need to be able to differentiate when they have malaria and when they have the COVID-19 symptoms. You need to explain this. You need to let people know that. Because really, I have some people that I know that they will just be at home and tell you they have malaria, and sometimes it's not malaria.
All right, Jide. Thank you very much for calling in. even as Mr. Koshile is not exactly a doctor, we did have a doctor here on Friday, but maybe Mr. Koshile will be able to pass on some of the things that the doctors have said.
Okay, that was actually the way I was going to put it. I was going to become a journalist here. I report it. Let me report what the doctors have said, particularly the health commissioner, Professor Akin Abayomi. He has said at many fora that the symptoms are, one, when you begin to have high temperature, which might lead to some symptoms like feverish symptoms that you get, and people feel that it's malaria. When you have high temperature, it's very important that you begin to look for further symptoms, such as cough. When you begin to cough excessively, it's also good for you to have a quick check. Then also sneezing is very, very important. So those are some of the agents that
Yes.
the
I
doctors have told us. I'm not a doctor.
Yeah.
I'm reporting what the
and
doctors.
it's important to
I'm also
emphasize
checking.
that.
I'm also checking myself regularly.
Indeed. And again, I suppose one has to take care not to be paranoid here, because people will sneeze if they're in a dusty environment anyway. And
I think some kind of sneezing.
Yes,
You yourself will know that.
Well, exactly.
This
I
is
suppose the
strange.
temperature thing. I suppose the temperature thing is the most crucial one, according to, if I remember what Dr. Finney was saying.
What Dr. Finney said the
yes,
other day
on Friday. But again, to Jide, you could please check the WHO website, which is updated every. I think it's almost every minute. For certainly, it's not within an hour.
Check the symptoms.
Just check symptoms and check all of those. The WHO website, is an invaluable resource. Don't rely on all those things floating around on WhatsApp and Twitter and all of these things. Just check out the WHO, because there's so many people trying to be helpful, but they're not authorities.
They're not.
But WHO website, in addition,
Or even Lagos State.
or Lagos State.
Please, you can check Lagos State Ministry of Health
Yes.
Twitter handle.
Exactly.
You have a lot of videos
Yes.
by Professor Akin Abayomi,
Certainly,
telling us what to do in case of any emergency.
And that would address the question that Jide brought up. Let's take a break now. We'll be right back. Please stay with us. Welcome back. Our guest this morning is Mr. Agboyega Akoshile, spokesman of the Lagos State Governor, Mr. Sanwo-Olu, and we've been looking at efforts and of the government of Lagos State, and in particular the leadership of Governor Sanwo-Olu, and how seriously he's taking all of this. And unfortunately, the first death in Nigeria has indeed been confirmed in Abuja, which brings it further closer home that it could happen anywhere. Now, the other thing is, can you share with us efforts about successes with tracking all those people that they need to track, which Dr. Finney was saying run into the thousands on Friday?
Okay, Lagos State government has professionals working on this case. They have people who have been trained. They are healthcare givers. There are people who have been trained in contact tracing. There are people who have also been trained. In fact, when you get to our biosecurity center in Yaba, I was there and I couldn't believe that this actually exists in Lagos State. And yes.
You're talking about how well appointed it was.
Yes, yes. So these are professionals.
And that's where the Italian who has now been discharged.
That's where the Italian, I actually went there.
Who has been discharged now.
Yeah, it's been discharged.
So, they fixed him.
Yes. So I was surprised myself. Not that I doubted the capacity of our people to be able to tackle this kind of issue, but the amount of preparedness of our people is second to none.
Okay, one moment, please. Sorry to interrupt you. Mr. Lawale is calling in from Ojodu, I believe it is. Good morning. Good morning. Mr. Lawale Ojodu, good morning. The network plays up sometimes, but I understand Mr. Lawale is on the line. Hello, Mr. Lawale, can you get us? Okay. While that is
Okay, so I
being
was
sorted
saying
out.
that I saw the level of preparedness of our people, which speaks to what Mr. Governor has been saying, that don't worry, Lagos State has the capacity to contain and curtail the spread of this virus. It speaks with so much authority. And so far, because Lagos is the epicenter, because we play host to the biggest airport and with the largest traffic in Nigeria. So, being the epicenter, Lagos cannot afford not to be prepared. And of course, we have a governor who is ever prepared to face whatever challenges. And don't forget that even in the midst of all of this, we've recorded 2 major incidents in the state, and it did not lose focus. We've had the Abule Egba explosion. We've had the Abule Ado explosion. Claiming many lives.
Sure.
Destroying many properties of people. So even at that, the governor did not lose focus. While he was approaching that, he is equally approaching this
Indeed.
pandemic.
Okay, let me try Mr. Lawale again. This time, I believe it's Mr. Lawale in Ikoyi. Good morning, Mr. Lawale.
Hello.
Hello, we can hear you.
Yeah, thank you very much. I pray that God will help us in the whole Lagos and the whole Nigeria.
Indeed, amen.
Like they were saying, I believe the issue of this coronavirus is not the issue of sensitization. We need to lock down the whole Nigeria. And that means that's an automatic quarantine for everybody. Lagos is tracing 1,000 numbers of people that possibly might have been, get connected with those who have been infected already. It's a long way to get them. But once you lock down, anyone that is sick in the house will surely come to the hospital. And via that, you get them tested, and those who have been infected.
Mm-hmm.
Because on the way you are looking for or searching for 1,000, or I don't know what the number is, they are already, the virus is already spreading to like 6,000 already.
Okay.
So the best thing that we should do is to lock down the whole Lagos State.
Oh, okay.
Nobody will die of hunger for like 16 days or 20 days. At least you will buy something in your house.
Okay.
And at the time, we get this thing to resolve. This is the issue of life and death.
Indeed. Thank you very much, Mr. Lawale, for calling in.
Thank you very much.
Yes,
Thank
appreciate your call. The whole question of a lockdown is a delicate one.
Yeah, it's been coming up.
It's a delicate one.
It's been coming up. A whole lot of people, some people have suggested that let's do a total shutdown. But don't forget that the leadership of the country, they are also very, very smart people. They are very intelligent people. They understand what you need to do at some point.
Okay. So that no doubt is under consideration.
It's under consideration.
It's under consideration.
And if you look at it,
it would have such far-reaching
it will have
implications.
far-reaching implications. And that's why Mr. Governor, in his wisdom, after consulting with the cabinet members and other stakeholders, decided that over 70% of the workforce should stay at home. And also, the federal government today is shutting down or has shut down the major airports in the country. So no flights are coming into the country as we speak from today. Now, for 14 days, let's even see that nobody is coming into Nigeria. Let all of us in Nigeria stay for within these 14, 15 days. And if we are able to see manifestation of this virus locally, now we can deal with them. Okay? We can deal with them locally.
Okay.
Rather than open our borders and people are still importing the agents that can transmit the virus into some Nigerians. Because if you look at it, initially we thought it was an Oyinbo man thing. You know, what people were saying in the city, that no, the black man, because of the heat here. No, some of the people that we have recorded in Lagos State are people who have never traveled.
Exactly, what they call community infection.
Exactly, one of them is even a driver.
Yeah.
Because I hear some people are saying that it's a big man. It's a big man that are, having coronavirus. No, it's not big man.
I imagine
it's not big man. That driver, if he has contact with his wife, who is a pepper seller, possibly, that woman will go to the market, deal with other people in the market. You see, this happens. It's not the first time that we're going to be having pandemic. It happened in 1918 in California, and they gave public advisory, public health safety, that people should not go out, but they defied that instruction. They went, for a car racing event, the following day. The following day or so. By the third day, over 200 people, fell sick, and they were hospitalized. Now, I'm told that in Italy...
I beg your pardon. There's another caller coming in. Good morning. Good morning.
Uncle Yori.
Good morning, sir. Thank you for calling in.
Uncle Yori. Good morning, sir.
Good morning. Thank you very much for calling in. Go ahead, please, your question or comment.
Okay. Uncle Yori, yes. I was trying to chip in this during the course of the saga of COVID-19. And I think the government should take it seriously now to get some form of partnership with private health institutions that's providing some kind of funds in case this pandemic goes a kind of awry. When it overwhelms the country. So if funds are given to private institutions or they are aided in a way by the government to cushion the effects, because what we've seen in Italy and let's say France and Spain, such conditions are now in a state where the country and health facilities in such countries are being overwhelmed, and they have been helped by the government. So I think we should think of mirroring such advancement we see in the advanced countries.
Thank you.
So that when this thing eventually tries to overtake us, because we are people who live, I want to use the word a bit carelessly, and we should be careful not to allow it to overwhelm us.
Thank you very much, Mr. Meme. Really appreciate your call. Thank you very much, Mr. Meme. In fact, you've spoken to the right because you've spoken direct. The spokesman of the governor is here, so he can take that particular thought back.
Well, I think such will be welcome anytime. Government, is open to any form of partnership that will bring about solution or succor to the people. And if you followed the activities of the governor of Lagos State, is a man that drives Lagos economy or other aspect of the state via PPP. Public private partnership.
In that regard,
he does a lot of partnership with the people. Because he realizes that the 70% of the GDP of the state actually comes from the private sector. So please bring it up. If you have any contact anybody who might be of assistance to the...
Mr. Meme is saying it the other way around, that it is government this time.
Should reach out.
Especially with funds, to private sector. And in that connection, I wanted to ask the question of test kits. How scarce or not are those essential pieces of equipment?
So I'm going to rely on what Professor Abayomi also said, the Honorable Commissioner of Health, that the test kits are not proven to be the right kind of tools for confirming or otherwise of coronavirus. So what he keeps saying is that watch out for the symptoms. If you suspect that you have been in contact with someone, watch out for the symptoms.
The symptoms will be better than a test kit.
Exactly.
So you might actually pass a test kit and still
And
have
then
it,
they are
and
still
actually
have
have
it.
it.
Yes,
I
yes.
think that point has been made that some people don't manifest symptoms and still have it, and it is transferable. Mr. Joshua Iniriwale, good morning, sir.
Okay, Ori, good morning.
Thank you very much
and
for calling.
I greet your guest.
Thank you very much.
Please, I'm trying to look at the area of this religion and government. I don't know how or why our government seems to treat our religious leaders with kid gloves. This is a serious issue, and yesterday some churches gathered. What are they gathering for? Please, the government there is Lagos. Let them understand that these governments of Lagos and Ogun State are the same government. If people gathered in Ota, most of them live in Lagos.
That's it.
So this idea of I'm in control of Lagos and then Ogun State is let loose, that's not good enough. We should have a synergy where governments are working together and getting people to comply. Please, when it comes to religious leaders, don't advise them. Give them straight instruction. No gathering. If you advise them to do 50, they will do 100. Tell them to close shop.
Okay.
Please.
Thank you very much.
This thing is very important. I beg you.
Thank you very much for calling in. Again, I want to go back, if I may, go back to Friday when we had Dr. Finney here. And she was reporting that she wasn't altogether happy with the way religious leaders were responding to advisories. And I want to link it up with what Joshua has just said, that which one is advisory inside?
Okay.
If you can't trust the religious leaders to do the needful, might we not resort to the law?
Okay. That's right. Now, I really want to thank Joshua for that call there. It gave us serious concern yesterday when we saw that some churches actually opened for business as far.
And you let them continue?
I don't think so.
Okay.
In fact, you know, if you looked at the countenance, it was on TVC. If you looked at the countenance of Mr. Governor, you realize that he is very, very was very uneasy with this disobedience by some religious organizations.
Or some trying to doctor the thing to suit them.
And can I just say something? We run a very responsible government. Now, Mr. Sanwo-Olu's government will not just wake up one morning and give a directive. Guess what? A meeting was held by the Honorable Commissioner of Home Affairs, Prince Elegushi, Anofiu Elegushi, with religious leaders in Lagos State. All of them, including the Muslim leaders and Christian Association of Nigeria, you know, the Methodists, all of them. And they were the one that agreed on the number 50. They were the ones that jointly agreed on the number 50. And Prince Elegushi reported to Mr. Governor. And Mr. Governor, you know, accepted.
I guess we can still tighten up. That is the point. We can tighten up agreements. We can tighten up agreements.
I think what may happen, Mr. Governor, like he said, that there may be a review. Okay. It may be a total shutdown. I don't know, but you know, if it feels that there are recalcitrant ones among them, it might make a pronouncement to say, you know what, we're shutting down.
Let's hear from Mr. Yahya calling in. Good morning, Mr. Yahya. Mr. Yahya in Kogi State. Good morning, sir. Yahya, can you hear us? Well, again,
the network?
Well, I don't know. Yahya, good morning, sir. Okay, you know, as soon as possible. So we were going back to this matter that was brought up by, you know, Mr. Joshua in Irewale, that people evidently were not being satisfactorily compliant with advisories. Shouldn't we then move to the next stage of, sorry, it's not advice, the law. Let's just let's just stay with the law here, because you know, people now, But that is, we can't say much more on that until we get some official feedback. But the whole matter about Lagos State government telling 70% of its people to stay away, that, as you said, will free up the streets because government is the largest employer, that kind of a thing. So the fact...
But with an advice to private sector to follow suit.
Yeah, to the extent that that can be done. Banks can't stay away.
I mean, the governor of New York, for example, 2 days ago, told in fact, he directed that non-essential staff.
So Lagos State government, civil servants, 70% of the civil servants in Lagos State, and government wants private sector to consider joining the initiative, are actually staying away. That's what you're saying.
For 14 days.
For the first 14 days, and that's paid it's paid.
Yes,
it's paid.
Yes.
Not all of them that are staying away will be able to work online.
Well, I believe that all Lagos State officials can work online.
I see. Okay.
Yes.
Good. So whatever, it works because that you've just given the lie to ideas that, well, we're not exactly like Canada, we're not like Switzerland.
That's a very dodgy.
This whole matter about being able to work from home.
They can work from home.
You've just confirmed now that it can be done because over 70% of Lagos State government officials have computers at home. Not literate. Are very, have computers at home.
Yes.
Have online access at home. Can link back into the office. And I think Lagos State was a forerunner in that. Worked with this
exactly.
There was this system. It eludes me just now. But
Oracle.
Oracle, for instance, you guys were very, very strong on that, and that's been going on for quite a while now.
Yes.
It goes back to, if I remember, I'm not sure if it was the Tinubu administration or the one that followed it.
So we were the first that
digitized. You're practiced in
yes.
this. So a lot of stuff can be done from home.
Yes.
Okay,
yes.
That's good. And this takes the all the Lagos State buses, which, because again Lagos State takes care of its staff, there are a lot of staff buses. It takes all of those ones off the road as well. Another caller coming in. Good morning. Hello. Good morning. Thank you. We can hear you. Hello? Hello?
Hello.
Yes, go ahead, please. Well, I just heard the call drop. I heard that call drop. So Mr. Boyega Akoshile is the spokesman of the governor. He's the chief press secretary, the Lagos State governor, and he's been giving us accounts of the efforts of the government of Lagos State and in particular how the governor himself is leading on this from the front. And some of the challenges will definitely need the, shall I say, the official stamp of the governor. What to do with people who decide that they want to take their freedom of movement and right to associate to the levels that are contrary to the advisories.
They will be dealt with in accordance with the law. It's very simple.
Well, that's the whole problem. For now, the law says that fundamentally you can associate. You have freedom of movement. Now, this is an advisory, and people are not playing ball.
It's not an advisory. It's actually a directive.
Then churches shouldn't have come together, breaking the advisory.
Sir,
I want to be careful not to say breaking the law.
Yeah,
breaking the advisory.
For every law, directive, or otherwise, it is not everybody that will obey. So those churches that you saw open yesterday are part of.
They probably have been noted. They probably have been noted by government.
Now, I even saw one, sent into our, our chat group by the task force. They were arguing with our task force that what we want to do is we have 50 people, on the first floor. We have another set of 50 people on the...
All of them maintaining 6 feet distance from each other. So you see, it's almost impossible.
It's a problem. So that's why we need to appeal to our people that, please, especially to the pastors and religious leaders, that it is not because of you alone.
I don't know.
It is because of me too. It is because
better?
of every one of us, over 20 million Lagosians.
Did you record a different experience on the Friday preceding yesterday with the Muslims, their own Jumat day?
Yeah,
was there better compliance, or was it the same situation?
There was over 80% compliance by the Muslim community on Friday.
Okay.
Yeah.
So
but there was-
that
in
was
fact, the National Council for Islamic Affairs, gave a directive, and backed it up by one of the sayings of the Prophet, which says that anytime there's some sort of strange sickness in a community, that's the people around there should stay within that community and not move out.
so the
until
Muslims
the
largely
sickness.
keyed in.
I think they keyed into the hadith of the prophet.
Yes.
So and they relied on that to obey the directive. I don't know why some, and I think to a very large extent,
I beg your
a
pardon.
lot of
I got a
Christians
call
also.
coming in from the UK. Good morning. Good morning. Good morning, Mikhail. Mikhail in the
My
UK.
name is Michael from London.
Good morning. Go ahead, please.
Yeah, good morning, Uncle Yoris.
Good morning, sir.
I just have one or two advice for Mr. Koshile.
Yes.
Mr. Koshile, can you please tell our people the phone number to contact in case they are feeling or they're having the symptomatology of coronavirus? That is number one.
Mikhail.
Secondly,
Yes. Don't bother to
can
listen to
you please
yourself.
tell us the preparedness of the Lagos State government? There is something you said now which is quite very not welcoming to me.
Don't listen to yourself, Mikhail. Just continue. Let it flow. Don't listen to the echo of what you've just said.
The Christian Association are the one that you said the Christian Association are the one that give you the number. Can you please help us with that? What do they need? Do they need to give you the number of the amount of people in their church? Kindly help the people in terms of the phone number to contact. We know the symptomatologies and the preparedness of your Lagos State government. I know you are trying. Please tell us the people. Most of the people don't understand the English you are talking about. What are you saying to the people in top of Yoruba to get themselves prepared if they are sick?
Thank you very much, Mikhail, for calling in from the UK. I guess Mr. Koshile will clarify. He wasn't talking about churches giving them numbers. He was talking about meetings where numbers were jointly agreed. But let Mr. Koshile clarify that area specifically.
All right, thank you very much, Mikhail, for that call. It's very important that we tell our people that this virus is very real. It's very important that we take precautions, all the safety measures, that have been publicized by the government. Very important. And you want us to give the number to call. The number is 08000 267 662. That is 08000 267 662.
Okay. Thank you very much. And then Mikhail might not.
Then you talked
he
about
might not know because
the joint. No, I didn't say that the Christian Association
gave you a number.
Gave no number. No.
A number emerged.
So what I said is that
mutually.
the Honorable Commissioner of Home Affairs had a meeting with religious leaders. When I say religious leaders,
and the number came up by mutual consent.
The Muslims, the Christians, and maybe traditional, and religious leaders.
Okay.
So, and they agreed jointly on 50. So, and that speaks to the kind of administration that is being headed by Mr. Governor Babajide Sanwo-Olu.
Okay.
A very responsible one that will not just sit down and wake up, from a sleep to tell the people, this is what I want.
Okay.
We want everybody to come together. It's a kind of stakeholder
run out of
engagement.
time. Thank you very much, Mr. Gboyega Akoshile. And indeed, thank you also for calling in and getting that particular response. Mr. Akoshile, thank you very much for coming along and sharing the efforts of the governor in this particular crisis and he's leading from the front. Okay, so that's our program. Please join us tomorrow for a fresh edition. I am Iyori Folare. Bye-bye for now.